All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, your community pharmacist. We're going to get right into your calls here. We've got Jerry, line one. Jerry, welcome to Pharmacist on Call. How may we help you?
How you doing?
Pretty good. How are you?
I was currently on prescription painkillers for years, and my question is I'm currently on Suboxone, but my insurance, TennCare, does not pay for Suboxone. They only pay for the Bunabills, and the Bunabills don't sit well with me. So, what I was wanting to know, is there going to be any changes to the health care?
Okay, in terms of coverage for Suboxone?
Yes.
I'm not sure, and that's a call. What insurance do you have, if I may ask?
It's a TennCare.
Okay, TennCare.
Amerigroup.
Amerigroup, yeah. Currently, yeah, they don't cover that, so that's going to be a call that they have to make at the insurance level. I'm seeing prescriptions come in actually for the generic tablets of Suboxone, which are more affordable for most patients. The strips are relatively high. I'm not sure which version you take.
Right, I take the strip.
The strips, yeah. So if your doctor is willing and you need to save money on it, then just have them, change it to the tablets. There are sublingual tablets that are now available for it. So if you take the 8/2, or whether you take the 2 milligram, yeah, there are generic tablets that are considerably cheaper than the film.
Okay. All right. Thank you.
Yes, sir. You're welcome.
Bye-bye.
All righty, bye-bye. All right, line two, we've got Lucy. Welcome to Pharmacist on Call. How may we help you?
Hey, Doc.
How you doing?
You just did a good job of explaining, like opioids. I can't even say it now.
Opioids. Yes,
how
ma'am.
they work on the brain and addiction and whatnot.
Yes, ma'am.
Is there any way that maybe you can explain how anti-inflammatories work? I have a damaged immune system.
Yes, ma'am.
And I have to be careful about what I take. I don't want to end up, where my body couldn't fight a cancer or like a lymphoma or something like that coming on, because my immune system's already suppressed, and I take like an anti-inflammatory, it suppresses it more. A drug like Celebrex, do they still make Celebrex?
They do, yes, ma'am.
Okay, and I'm not picking on Celebrex, but can you explain how maybe an anti-inflammatory might suppress your immune system? And I'll take your remarks off the air.
Yes, ma'am.
Thank you.
Good question, by the way. So now I got to dig up all my pharmacy school notes that somebody else took for me. So your anti-inflammatories there is an enzyme called cyclooxygenase, or what we call COX, or COX-2s. So what the anti-inflammatories do is they inhibit this enzyme or what have you, whatever the substance is, from causing inflammation. So they're anti-inflammatories, they are COX-2 inhibitors. So things like your Celebrex, which its chemical name is celecoxib. So I'm pretty sure it has something to do with COX-2 inhibition. So you have to understand that the immune system responses, many of them are also inflammatory in nature. So, and it's probably a deep cascade that you all probably wouldn't understand or don't want to hear. So I could see that the COX-2 inhibitors would also suppress the body's inflammatory response. And the reason the immune system does this is it has no clue what's going on. It just knows that something foreign is going on. It needs to cause inflammation to get rid of it. So we take these pills, so that's why our throats get sore, that's why we, so what the immune system, the medications do is stop the immune system response. The only thing is, the immune system response is meant to help defend us against foreign invaders. So when we do that, when we take things like acetaminophen, and which I think is, that goes through, it's not COX-2, I think it's catecholamine O-methyltransferase. I'm sure somebody who's smart is watching this could probably verify that. I'm not sure, but so what that does is suppress the immune response. So that, Lucy, is probably the role that it would have, kind of like your prednisone will. It also is an anti-inflammatory, but it is a direct suppressor of the immune response, being a corticosteroid. So I hope that answers the question. I did want to go a little bit further, a little bit deeper. So talking about addiction and the neurotransmitters in the brain. So it's two that are mainly involved. You got dopamine and you got serotonin. Dopamine is our woohoo, our feel-good neurotransmitter. So it is the one that, you know, is the pleasure-seeking neurotransmitter. And then the serotonin is the happy and content one, and it gives us our feelings of satisfaction. So what happens with addiction and the brain chemistry is you got three different types of things happening. You've either got, so normal person, serotonin, dopamine balanced. In one case, you've got dopamine really high and serotonin low, which may manifest itself as, you know what, man, I'm not content with myself. I'm feeling kind of down. You know what, I want to seek some kind of pleasure. I think I'm just gonna do drugs for the heck of it. All right, so that's the over dopamine. If we have the converse go on and we have an overly serotonin person and low dopamine, so they're like, well, you know, I'm kind of restless and I'm not focused, because serotonin is what keeps us focused. So for those of you who take SSRIs, you'll know that your focus improves, your happiness, your contentment improves while you're on that medication, because it increases the serotonin levels. But when serotonin levels are high, oh man, you're prone to make rash decisions. You're fidgety, and so you're unfocused. And so you will just try the drug in order to make yourself, feel better. All right, and then you have low serotonin and low dopamine, and that's when you're just like, you know what, man, forget it. You know, what's the use? You're kind of in your gothic teen mode. You're just, and no offense to all you gothic teens out there, but you're in a really down, depressed mode, and it will have you turn to drugs in order to seek pleasure as well as to feel better. So those are the three types of things that are going on while you become addicted. Again, doesn't mean you're a personal failure. It's just, it could happen to anyone. And as I've said in previous shows, if the Pope takes these medications long enough, you better believe that he's going to become addicted as well. We've got another call, so let's get into it. Charles, welcome to Pharmacist on Call. How may we help you?
Yes, sir. How you doing?
Pretty good. How are you?
I'm doing better. I have done better. What I'm calling about, I used to take meloxicam for arthritis in my joints.
Yes, sir.
And I had to quit taking it because I developed an ulcer, and the meloxicam seemed to aggravate it.
Yes, sir. That is true.
And I was just wondering if there's any other thing I could take, because I don't want to go to pain pills or nothing for it.
Yes, sir. So where exactly is your pain? Is it mainly in your joints?
Yes, sir. It's in my right leg and knee and hip and lower back and all that.
Okay. Does the pain kind of shoot down your leg sometimes?
Yes, sir. Sometimes I get up in the mornings, my right leg's so stiff I can't hardly walk.
Okay. Sounds like you may have a...
When I took the meloxicam, I've done a lot better, but like I said, I can't take that no more.
Okay. So it looks like you got a couple of things going on. So yeah, the meloxicam is a little rough on the stomach, like all of the anti-inflammatories, even the one that Lucy just mentioned. Yeah, so that's why we caution patients to take them on a full stomach, because they can eat through the lining of the stomach. I'd probably recommend something like turmeric. Turmeric, which I've talked about. It's a spice, but it has tremendous anti-inflammatory properties. It's all natural.
Turmeric?
Turmeric, yes, sir. You ever heard of curry chicken or curry goat?
Oh, yeah, I've heard of that now.
Yeah, so that's the spice that they use to season it. It's
okay.
Yeah, curcumin, if anyone is familiar with that. Yeah, turmeric. So it is an anti-inflammatory, won't give you the kidney issues, won't give you the liver issues that a meloxicam or some of the other anti-inflammatories will. Guess the verdict is out on whether or not it would upset your stomach, but it comes in capsules, but it certainly shouldn't, should not cause the stomach damage that it does. Now, the other thing, since you're telling me that you have lower back issues and it's going all the way down your leg, let's have the doctor give you a little something for neuropathy too, to take along with whatever anti-inflammatory, or whether it's turmeric, because pressing of that nerve will send pain signals all the way down to your leg. And you probably notice it if you turn a certain way in the bed, if you sit a certain way while you're watching TV. It's called neuropathy. And sometimes your leg may be numb when you get out of the bed. So ask your doctor about adding gabapentin to your regimen.
Okay. Okay, well, say, I got high blood pressure, high cholesterol, and all that stuff too.
Oh, yeah, yeah.
No
Well,
diabetes, so.
okay, but yeah, turmeric then is certainly great for the heart. Will not push your blood pressure up.
Okay.
Yes,
Okay.
sir. All right.
All right. Thank you.
Yes, sir. Thank you. Welcome to Pharmacist on Call. How may we help you?
Hello.
Hey, welcome to Pharmacist on Call. How may we help you?
Hey, Doc. This is B. I've talked to you a couple of times in the past,
Yes, sir.
and I'm on a lot of opioid pain meds, and I'm getting injections in my lower spine and the sciatica area.
Yes, sir.
And my friend, he's had the same problems, and he's taking hemp oil.
Okay.
Do you have any thoughts about hemp oil helping me get off of these opioids, or am I going to have to suffer with it because I got fibromyalgia and diabetic nerve pain? I'm going to get gabapentin. That's pretty good.
Mm-hmm.
But the morphine and the oxycodone, and it sounds like they're trying to make everybody get off the meds, the government.
Yeah, I think they are. We have some people on them that may not necessarily need them.
Yeah, I've been in pain 27 years, and it's getting pretty rough. I do get depressed, you know. It goes along with it.
Yes, sir.
Pain, you can't do anything. But,
Absolutely. Yeah. So, yeah, I would agree with you. In terms of hemp oil,
Yes, sir.
there may be something there to it. And so now we're getting ready to spark up the whole marijuana debate.
Yes, sir.
Because marijuana does seem to have some pain relieving properties. And some of my patients who come to me, and they tell me that marijuana does help them with their pain.
I think he's
And-
smoking it and taking the hemp oil too, but I pop positive on a test, and they'll kick me out of the pain clinic most likely. I haven't asked them about it. I'll go back on the 31st. I thought I'd bring that up.
Yeah, and if you just want to try something natural that may not show up on the test,
Sure.
we could probably go the route of maybe something called Coridalis.
Chloradalis.
Coridalis, Corydallis. It won't give you the full pain relieving, efficacy of some of your prescription drugs.
Yes.
But it'll get you close, and that's why I think most people that are on pain meds, you just want the pain level to be cut down. You don't expect it to be totally gone, but just to where it's manageable.
Yes, sir, where I can live my life. And right now I've been in, the bed for about a year, going on a year and 2 months now. And I know that's not good for you just to lay around, but I can't get up and go. I got a quail system, a TENS unit. It goes
Yes, sir.
on your leg.
Mm-hmm.
And that kind of helps a little bit on that nerve.
Okay, we're going to recommend some Kangen water for you too to help get some of that acid out of those joints.
Yeah, I'm in Columbia, so I'll have to make a run and buy a big load of that water.
Yes,
I
sir.
tried electrolyte water. That's not what you're selling.
No. We're selling something much better.
Okay.
And so we
I'll
have
let you answer other calls, and thank you
okay.
for doing the show, and God bless you.
Yes, sir. All right, thank you.
All right.
All right, bye-bye. All right, looks like we've got another call here. Robert, welcome to Pharmacist on Call. How may we help you? Hello, Robert.
Yeah, I'm here.
How may we help you today?
Hey, is there any arthritis medicine? I've got real bad arthritis, like maybe across the counter that I can use.
Okay, what have you tried already?
Well, the doctors, I was just watching you on television. He's had me on that Meloxicam 7.5s.
Yes, sir.
Then he gave me the Docalex,
Diclofenac?
the cream, Voltaren cream.
Yeah, diclofenac.
Yeah.
Yes, sir. That help you any?
I mean, it helped a little bit, but not much.
Okay. Where are you finding your pain coming from? Where are you hurting?
It's coming from the back of my left leg.
Okay, so it sounds like you've got the same situation going. You said the back of your left leg?
Yes, sir.
Around the calf area?
In between my joints, between my hip and my leg.
Okay. Have you had back injury before?
No, I know I got to have a knee replacement.
Okay. The pain is between your knee and your hip?
Right.
Oh,
But it's
okay.
in the back of my leg, where the joint is.
Okay. Are you on any medication for cholesterol?
No.
Okay. Okay, you got varicose veins?
No, I don't have that.
Okay, okay. Your doctor ever tell you have any blood clots or anything floating around in there?
No, he hasn't. You know, he's asked me that. And
Okay.
I don't.
Okay. Well, just to basically, if you've tried diclofenac and meloxicam, I mean, those are generally two pretty good anti-inflammatories. I'd recommend turmeric also. So we sell a lot of it because it does work pretty well, especially the new formula we have is combined with black pepper, which helps its absorption and its efficacy. So it helps the turmeric work even better. So I'd give it that a shot along with the Kangen water.
Could I get that like on across the counter?
Yeah, both are available at the store over the counter. No prescription needed.
Well, good. I'll come see you guys because I know where your pharmacy's at.
Yes, sir. Yeah. Come on, stop by.
Okay, thank you, sir, very much. I appreciate that.
All right, thank you.
Bye-bye.
All right, bye-bye. All right, everyone, we are up on a break. Call in. We'll be right back.